Good evening once again and a very warm welcome to Rwanda Television News. My name is Gloria Mutesi. Officials in the Ministry of Education have announced that nursery and primary school students that have not yet returned to school will do so on the 18th of this month of January, 10 months after they were first told to remain at home because of the COVID-19 pandemic. Saishinara starts us off tonight with this story.
Parents with children in nursery schools as well as class 1, 2 and 3 in primary school had started to ask that they too be allowed to return to school like others. The children were loitering all day on the road and seemed to have started forgetting all they had been taught, things like the English language. It's a problem and we want them to just go back to school. They too can practice preventive measures just like the rest of us. Their going to school was helping us because they would return tired and take naps in the afternoons, but now they no longer do that. We understand that the coronavirus pandemic is a serious problem, but the government should really help us and allow these kids to go back to school. Education officials have now confirmed that all remaining students in nursery and primary school will resume their studies on the 18th of this month of January. Over the next few days, we must go around the schools to check that all equipment is available, especially desks, and that teachers are present. We must also look into cleanliness and other sanitation issues, preventive measures, and coordinating with school administrators so that COVID-19 measures are respected and the children are protected. We do have concerns that the kids are quite young and practicing preventive measures might prove challenging for them. But the good thing about young minds is that they adapt easily and they do as they are trained to do. School administrators say they are up to the task of receiving the children. It won't be as difficult as some may imagine because some older kids have been studying since November the 2nd and others started on the 23rd of that month. Certain guidelines are being implemented so that they can be protected from this pandemic, and the older children will assist the little ones to do the same. All we have to do is ensure that all that is also enforced in classrooms. Parents are sighing in relief that their toddlers are finally going back to school. As parents, we are very happy about the news because they have spent almost a year at home and they are not being taught by a teacher who's proving a problem. Officials in the Ministry of Education are reiterating, however, that all people must play their part in protecting the kids from COVID. There was a version of the theory that stated that children get the virus at school and bring it home to their parents, but really the parents are the ones that get it first. So if we protect ourselves as adults, we will be able to also protect the children so that schools do not close down again, because we really do not want that at all. 80% of 22,000 new classrooms built as a way of fighting overcrowding are now complete. First-year university students are supposed to start their studies in March if nothing changes.
While the World Health Organization confirmed that more than 2 billion people around the world seek treatment at health centers with no water supply, Rwanda intends to ensure that all health centers are with adequate water by 2024. Of Rwanda's 512 health centers, only 19 are without clean water. Jen Mutoni has more.
A health center in Ntarama sector, Bugesera district, is one of the health centers with enough water supplies from both wasak and rainwater, which is stored in 3 tanks with a capacity of 15,000 cubic meters in case there is no running water, as explained by the head of Ntarama Health Center, Raphael Twagirumukiza. We usually get a lot of water during the rainy season. As you can see, we have many tanks for storing water, even when we are receiving water from Wasak as well. We haven't faced any problems with water so far, as we also have machines which filter water for patients to drink. On one hand, a health center in Mwogo sector, Bugesera district, there is a water issue, as explained by its head, Nyeragutabara Dede Leonard. We've not been receiving water from Wasak for the last 3.5 years. We are also facing a problem of locals suffering from ringworms and other diseases due to not accessing clean water, hence leading to lack of cleanliness. The Minister of State in charge of primary health care, Dr. Mhunga Tarsis, says all 47 hospitals and 493 out of 512 health centers have access to clean water, leaving only 19 health centers with no clean water. He says by 2022-2023, all health centers will have access to clean water.
When
we say 19 health centers are without water, we mean the inconsistency of water supply, although they usually find ways to get water. I would say Rwanda stands out concerning the issue of water in health centers or hospitals. Sometimes a water pipe may break, hence distorting the water supply. In such cases, they are usually repaired, as we hope that in the government plan, within 7 years to come, all these issues shall be solved. We've also ensured that each new health center and those which are under construction, there are enough water supplies, and in hospitals as well. According to the 2020 report of the World Health Organization and UNICEF, shows that 1 out of 4 hospitals are without clean water. An employee in charge of environment at the WHO branch in Rwanda, Innocent Habimana, says Rwanda continues to stand out in terms of water supplies in hospitals.
Hari raporo ya OMS na UNICEF byagaragaje Rwanda.
A report from WHO and UNICEF shows that Rwanda is in the top 10 countries which have stand out in terms of fighting the spread of COVID-19 virus and the provision of water in health centers and the establishment of hand-washing facilities in a very short period of time. Health centers without water were supplied, which made Rwanda exemplary to other countries. According to the statistics by WHO, from 760,000 hospitals in 165 countries, shows that a total of 2 billion people seek treatment at health centers with no clean water, hence doctors and patients acquiring diseases caused by dirty water. In 47 developing countries, 1 out of 2 hospitals are without clean drinking water, while 1 out of 4 hospitals are without hand-washing facilities, while 3 out of 5 hospitals are without public cleaning services. Statistics from WASAC show that 7 out of 10 Rwandans have to walk 200 meters to access water, while in the city, 5 out of 10 locals have to walk 500 meters to get water. Jane Mutoni reporting for RTV.
And after the ban on all travels connecting districts and the city of Kigali in line with controlling the spread of the COVID-19 pandemic, those who are coming to Kigali in search of health services have expressed worry, and some who have been discharged from hospitals within the city say they do not know how they will return to their homes to the provinces.
At different referral hospitals in Kigali city, you find different people that were discharged but failed to find ways to get back to their families due to a ban on travel connecting Kigali and other districts due to the COVID-19 pandemic. At Karayez Ndera Neuropsychiatric Hospital, before these new regulations, between 300 and 350 patients received treatment daily, but now it is between 100 and 150 patients, a problem that is not only evident here but also other hospitals. I came on a motor and it left me in Nyabugogo. Then I figured out the rest of my journey to here. The challenge is the daily cost in transport. I used 5,000 Rwandan francs per trip. We woke up early in the morning around 4 a.m. We climbed a hill. We reached somewhere called Rushachi. We reached somewhere and got tired and sat down till a good Samaritan came to our rescue and asked us what the matter was. As people who were discharged, we request that they find us ways on how we can get back to our families. It's been 2 weeks now since we came in an ambulance escorting my parent to give birth here. We request that you advocate for us. They find us ambulances to return us to our homes. The director of the University Teaching Hospital of Kigali Sehashk, Dr. Theobald Hatejekimana, says that they have had discussions with the Ministry of Health to help patients who came in ambulances, and in case the number is large, a list should be made and sent to the Ministry of Health. This comes after Shimimana Michel, an administrator at Karayez Ndera Hospital, says that the number of patients coming to the hospital for treatment reduced, posing a great threat to patients whereby they might become more ill. We make lists of patients, taking the same route as we were instructed by the Ministry of Health. To those who figured their way here, they will still have to figure their way back. If we prescribe the medication, one has to figure out how to reach here and back. We are only considering only those that came in ambulances.
Dukora liste y'abarwayi bagomba kujya mu ntara.
There are patients that are finding it hard to reach here for treatment as before. We used to receive between 250 and 300 patients, but now they reduced. Those that fail to make it here are now up to 150 every day, whereby some of these will fail to recover from their illnesses. And Public Health Services Department at the Ministry of Health explains that the issue is still being addressed. As the Ministry of Health, we use vehicles that transport patients transferred to Kigali or for other duties to ensure that they transport those that were discharged as well back to their respective districts. The other thing is working hand in hand with referral hospitals to give us lists of those that were discharged, which we forward to the district hospitals to consider taking them back to their homes. To those with prescribed medication, again using these vehicles, we ensure that they transport that patient to the medication receiving point and again transport him or her back. Not forgetting that the Ministry of Health also empowered district and other referral hospitals with health experts. In Kigali City, hospitals that receive patients sent by the district hospitals include the University Teaching Hospital of Kigali Sehashk, Kanombe Military Hospital and Karayez Ndera Neuropsychiatric Hospital. Innocent Mugabo, RTV News.
Thank you, Innocent, for that report. Now, Rwandan nationals living in Bangui, the capital city of the Central African Republic, are saying that the perspective locals there had of them drastically changed after RDF peacekeepers arrived in that country. In the following report, filed by RBA's Jean-Pierre Kagabo, who is in the Central African Republic, and translated by Serge Nore, we take a look at the lives of Rwandans who have made a home for themselves there.
Our first interview was with a Rwandan businessman working in a suburb of Bangui, affectionately referred to as Kigali. They started calling this place Kigali because many Rwandans started to come here, gathering and setting up shop and residence. Soon, Burundians started joining us and other foreigners started calling this suburb Kigali. Because here you can't really tell apart Rwandans from Burundians, everybody just started saying we are in Kigali and using that name when giving directions to others, and so it stuck, even though there is no signpost declaring that name. Rwandans were not always welcome in the Central African Republic, however. When we first arrived in this country, everybody looked down on us. After RDF peacekeepers arrived, everything changed. They initially came in as AU troops, basically saved us all because everything had come to a halt here and things began to return to normal. When the locals saw the peace and security Rwandans had restored, they started to embrace us as brothers and warm up to us. Rwandans have since built up a reputation of being very hardworking. They see us as very hardworking and energetic because of how we do our best to earn money and get cash. We are truly blessed in that aspect. That is what I can say, because we know how to make money and never feel any sort of work is beneath us. We have built up a very good reputation for our country Rwanda here, because even the president of the Central African Republic loves us because of how we do things. Our soldiers have also made a name for themselves, and that has only given Rwanda even more credibility. What we have here because of our President Paul Kagame is hard to explain. Thanks to the support he has been sending, we Rwandans are very popular and people always want to know if we are really Rwandan nationals. RDF peacekeepers also visit us regularly to see how we are doing. Paul Kagame has not abandoned us, even though we live abroad. He has continued to follow up on us. We have security. The reputation Rwandans have in that country improved even more during the election period when RDF special forces arrived. You would have had to be here to truly understand how things were at that time and the tension in the air. All a person had to do was blow a whistle to send everybody scurrying in different directions and ducking for cover. Suddenly, we started seeing troops we had not seen before, and everybody was afraid at first, thinking we had been invaded, until we noticed that they had the Rwandan flag on their shoulders as an emblem, our country's flag. While civilians and local soldiers alike were fleeing from different areas, the special forces were heading towards the trouble and reassuring people along the way. Soon the shooting stopped and peace returned, and now everybody is praising Rwandans and Rwanda and saying thank you, Kagame. As the rebels closed in on Bangui and rumors became rife, we all felt that we were in imminent danger. But soon we heard that Rwandan special forces were coming in to work alongside the UN troops on the ground to salvage the situation, and the local residents were overjoyed. Even now they are still saying it is thanks to us when they see Rwandans. Rwandan nationals living in the Central African Republic have, however, one more thing they ask of their country. Based on the relations Rwanda has built up with the Central African Republic, also taking into consideration that it was the only country, excluding those in MINUSCA, to come to the aid of people here when it seemed that things had started going sideways again. Our government should open up an embassy here so that we can continue assisting this country to come out of this trouble, basing on our own experiences and how we overcame our own problems. They are, after all, our African brothers. In addition to Rwandan nationals who went to CAR back in 1994 and in the years afterwards, other recent Rwandan investors have been going there to start businesses.
Thank you to our colleague Kagabo for compiling that report. And now bringing you back to Rwanda, beneficiaries of the Vision Umurenge program in the southern province, especially the elderly, have noted that they need such support in their old age. However, there are those that invested money given to them in the construction of commercial buildings, and now they say that they may pass away without reaping the profits of this investment. And they are asking that the buildings be sold so that they can use the money now. The support, called Akabando Kabasaza, is assistance given to vulnerable elderly people. Some of the recipients decided to form cooperatives where they save money from the Vision Umurenge program to be used later. The members of these cooperatives say their savings help them in solving some problems as they wait for the VUP support. Madeline Nyiratabaro and Jean Bosco Bizimana are members of the Tuzamurane cooperative, and they praise the benefits of being in this cooperative. I used the first support I got to repair the walls of my house. I really benefit from the support, and I currently owe 10,000 Rwanda francs to the cooperative. When you have no special problems, that money helps a lot. VUP supports helps us a lot. It wasn't easy to get something to eat before. A member can ask for a loan, and I also did the same, which helped me buy a piglet. I told you that when we are waiting for the support, the money saved in cooperatives helps us a lot, and you can borrow some money when having a problem. However, there are others that decided to invest the money in the construction of commercial buildings. The members of Abizeranye cooperative in Huye district say that they do not benefit from this project and are requesting to sell the buildings and divide the money. We rent each room for 15,000 Rwanda francs per month, and we had agreed that we will all be getting dividends every 6 months. But we no longer get that money. Now all we get is 15,000 per year. When we started the cooperative, they promised us that it would help us to come out of poverty. It would have been better if we had used our money for something else, like buy livestock. The Southern Province Governor, Alice Kaitesi, has noted that beneficiaries of the support are not required to engage in such joint ventures. It is additional support, as it is implied, that helps people to make a living. There are those that chose to buy livestock, and starting projects was done before and didn't work because some weaknesses were found. Now there are no projects being engaged in, such building reception halls or buying domestic animals as a cooperative. That's no longer being done. They now use the money as additional support to meet expenses and fight poverty as they wait for their regular monthly allowance. On the projects that were already implemented, the governor has said that they are planning to do a follow-up in collaboration with the local administrative entities development agency to see which projects need further support and which are beyond assistance and should be shut down. The support given is 7,500 Rwanda francs per person that increases based on the number of family members. 35,075 old people in 8 districts of the southern province received the support from VUP. Also in the news today, the Rwanda Water and Forestry Authority is confident that a bamboo processing plant will be operational in the month of January. Now, while bamboo trees have been instrumental in conserving the land along riverbanks, citizens now say that bamboo can be used for so much more. People that live and work around riverbanks are grateful for efforts put in planting bamboo trees to combat soil erosion and preserve the land around the banks. These bamboo trees are useful for us on the banks of the Nyabugogo River. Before they were planted, we had lots of soil erosion, but now that has been resolved. The bamboo trees are a source of shade for us when it shines a lot, or even if it drizzles a bit, we can seek shelter from them. On the other hand, there are those who believe that these bamboo trees not only protect the land, but can also be beneficial to people in other ways. Bamboo trees have multiple uses, such as construction of houses, among other things. We're even wondering why these ones have not yet been harvested so others can be planted. There are other people that produce accessories and ornaments from these bamboo trees, and they wish that more can be done to get better products. Jean-Pierre Mugabo, the Director General of the Rwanda Water and Forestry Authority, says the Ministry of Environment has already signed agreements with investors and that bamboo value-added activities are about to begin. We have a 40-year contract, so we are confident that starting this January 2021, we will increase the number of forests in the eastern province and we will be having various products from bamboo trees. The bamboo factory has started in an industrial area, although we haven't received some machines yet because of delays due to the pandemic. But the investor is doing their best so that by January 2021, they would have begun operations. The agreement signed between the Ministry of Environment and the investment firm, the East African Bamboo Industry, stipulates that bamboo trees on about 171 hectares along riverbanks will be the first to be harvested, and others will be planted in the eastern province and by the banks of the Akagera River, as well as other places too. On behalf of the entire news production team, thanks for your company tonight. The plan is still the same, and that's to fight against the spread of the pandemic, each in our own capacity. I'll do my part, and I encourage you to do the same by wearing your face mask diligently and keeping your distance. Otherwise, God bless you and keep you, and until next time, I'm Gloria Mutesi.